today. Health Canada did secure a new supply of children's medications, specifically, as I mentioned, acetaminophen, which has been hard for parents to find in recent months. Now, the product will be imported from a foreign supplier. Ottawa says it has been reviewed by Health Canada to be safe and effective, and the medicine will supposedly be available in pharmacies within a few weeks. Now, for more on all of these topics, we've reached Jen Belcher. She's a pharmacist and vice president of the Members Relations and Strategic Initiatives at the Ontario Pharmacists Association. Welcome to the program, Jen.
Thank you for having me.
Let's just get right into this issue. What is the problem with securing children's products? We heard there Danielle Smith alluding to something that the opposition leader had been saying earlier. It's because it needs to be in French and English on the label. Is that true?
So for consumer health products that are sold in Canada, yes, we need to have instructions and information available in both of our national languages. And most of those consumer health products for use in Canada with acetaminophen, ibuprofen are manufactured here. What we've seen is that since August, the Canadian Pharmacists Association has advised that the demand for these products has exceeded 300% of our previous all-time highs. And this demand has just not been able to be fulfilled by the manufacturing capability that we have currently. So this news of the foreign supply being brought in to help bolster the situation right now is good news. But definitely we look forward to seeing more of our domestically manufactured supply enter the supply chain so that we can continue to meet the need that is currently being left unmet in the shortage context.
So the simple answer to it is that the demand is so high, they just can't keep up with production here in Canada?
Correct. So the demand has come much earlier than would normally happen in each season. Our respiratory illness season has hit harder and faster and at an atypical time. We normally wouldn't see that high level of demand in the late months of the summer. And so manufacturers' preparedness to be able to respond to that is really subject to a lot of different complex variables. And ultimately, it doesn't just turn on at the drop of a hat. So we do need that time to ramp up supply, additional ingredients, things even such as bottles or caps could need to be ordered in greater quantity to be able to upregulate that production. And ultimately, these changes in the seasonality and the levels of demand have resulted in a situation that couldn't have been predicted. And now we're facing a shortage as a result of it.
Can I just ask what I think might be a dumb question, but in the States, they're also seeing a huge demand too, but their store shelves aren't empty.
Mm-hmm. Yeah, I can't really speak to their supply chain. Ultimately, what we do see here is that there's a real need to look at the supply chain sustainability within the Canadian context. And it's really important to bring all stakeholders into that conversation. And I'd say especially pharmacy professionals who are at the front line of trying to manage this shortage alongside their patients and parents.
Is there something that the levels of government should be doing more of?
Ultimately, we need to look at how we regulate and manage our domestic supply chain, but also how we're supporting our frontline professionals in helping our patients navigate these situations when they arise. We're seeing in pharmacies really high levels of inquiry coming in, parents frantic to find supply. And ultimately, it's a really challenging situation because we're educating parents on what other things they can do. Some of our pharmacies are compounding as a short-term interim solution to meet the gap. And this is coming at a time where pharmacy care that we provide is at a very high level. And so these additional shortages place a lot of strain on our teams, on prescribers, and as we've seen on hospitals when parents don't have the tools in hand to manage the symptoms and need to go and seek medical care.
Yeah, so maybe you could give some advice to parents who can't find the drugs that they need to help their kids feel better.
Yeah, of course. Ultimately, there are a couple different solutions. When you're looking for children's Tylenol or ibuprofen, there are adult tablets that could be used in increments of a half or quarter, crushed up, placed on a soft food, and then have that food consumed by the child to get the full dose. That's one way that we manage in our household. Chocolate is a very good flavor for masking bitter tastes if your child is having trouble managing to eat the food because they don't like the way the taste has been altered. So chocolate ice cream, big thumbs up from my toddler here on that. Some pharmacies are also compounding oral liquids for kids that either haven't been able to use some of those alternative strategies. And then ultimately, your healthcare provider, your pharmacist can talk about some non-drug things you as a parent can do to make your child more comfortable and help manage some of those symptoms, and when you should be seeking medical attention when things maybe take a turn for the worse. So definitely have that conversation with your healthcare provider, and we can help with that.
The federal government says it secured a new supply of acetaminophen and fever medication. How quickly do you think that will be on store shelves?
Yeah, ultimately that will have to be imported and then redistributed to the provinces and then out to the supply chain. So depending on when it arrives on Canadian soil, it could take several weeks, and we'll continue to support our parents and our patients in the interim with some of these other solutions. But it's good news to hear that supply coming in for the community pharmacy and retail environment, because we know to date that most of the imports have been allocated to hospitals, which makes sense, but definitely there's need within the community for these products as well. So encouraging to hear on that front.
Jen Belcher, I want to thank you for joining the program today.
Thank you for having me.
Jen Belcher is a pharmacist and Vice President of Member Relations and Strategic Initiatives at the Ontario Pharmacists Association.